Good afternoon. Welcome everyone to this SEDIL seminar. Today, we are very excited to have a large group of panelists today to present one of the studies funded by SEDIL on the evaluation of WASH interventions. And just a bit of a housekeeping before leaving the floor to the speakers. I need to mention first that the program is, well, the study was funded by SEDIL. SEDIL is a program funded by FCDO. This is brought to you by UK Aid. And you will have opportunity to ask questions during the seminars, but you are muted. We would like you to ask questions using the chat function at the bottom. So if you can please type your questions and we will try to answer as many as you can. Final thing that I would like to ask you is at the end of the seminar, when you will leave the seminar, that you will be asked to fill a short survey. And so that's for rating the seminar, give us some feedback, and please do give us some feedback because this helps us to improve our webinars. Well, that's all for me. And I will now leave the floor to the speakers. And so we do have a chair, Jessica MacArthur. So please, Jess, over to you.
Wonderful. Thank you so much. Welcome to everyone who is joining. My name is Jess MacArthur. I am a researcher at the Institute for Sustainable Futures, hosted at the University of Technology, Sydney. And it's my pleasure to be here chairing today's conversation on gender equality and WASH. We're going to get into many of the details of what that means and how that intersects with social inclusion as well. But we're going to begin today's discussion with a brief presentation from Biljana. Biljana is a senior research fellow at SEI, the Stockholm Environment Institute, and is an environmental social scientist. And her focus is working on robust evidence for decision-making in environmental policy and practice. She's a specialist in systematic evidence and synthesizing evidence together to make important improvements and contributing to guidelines and standards. She's also the co-creator of reporting standards for environmental evidence synthesis, which is called ROSES, and an associate editor of the Environmental Evidence Journal. So it's my pleasure to welcome Biljana. Would you feel free to start? And again, if you have any questions for Biljana as she goes, please put them in the chat. We're going to listen to 3 presentations first, but we will come back and ask questions. So don't forget to put your questions down. Over to you, Biljana.
Thank you so much, Jess. I will now start sharing my screen. I hope you can all see this. So as Jess mentioned, my name is Biljana Matsur and I'm a senior research fellow here at Stockholm Environment Institute in Stockholm, Sweden. Today I will present a finding.
Can you bring the one in the...
Sorry. Today, I will present the findings of a review funded through SEDIL and UK Aid. This review is about gender equality and social inclusion outcomes of WASH interventions. And after me, my discussants will actually discuss a little bit more what is happening in their own organization or connected to GESI mainstreaming in WASH interventions. And also a comment on the findings of this review. So first of all, just to acknowledge everyone who has been collaborating on this project with us. Here is the list of project team, working group, affiliated researchers, and the advisory group. And I won't go into listing names here because of the time restrictions, but we are very proud to have been collaborating with all these people on this evidence synthesis. Well, we started this systematic mapping in response to actually a synthesis gap, namely WASH evaluation practices, mostly focus on public health and technical outcomes. And there is somewhat anecdotal evidence for outcomes of connected to gender, social inclusion. Also, at the time of writing this proposal for this review, WASH evidence synthesis had no explicit focus on gender education or other social outcomes, and gender was just considered as a contextual factor in WASH intervention design or adoption in this WASH evidence synthesis. And they were evidence synthesis that were existing at the time, but they were focusing on social outcomes and gender. They were quite narrow in scope. There was 3IA funded evidence gap map, and now last year updated. You have references on the screen. However, they have map the outcomes that are connected to gender and social inclusion, but these outcomes were mostly derived from quantitative evidence. So in response to this gap, as I mentioned, we decided to do a review of the evidence on the impacts of WASH interventions on inclusive and transformative gender equality and social inclusion outcomes. To do so, we have tried to include literature that talks about any type of interventions that are providing water, sanitation, hygiene, both software and hardware technologies implemented in both rural and urban settings. We were open for any types of low and middle income study participants. We were open for different gender and social categories and age groups. And also we were including in this review any type of inclusive and transformative GESI outcomes. What are these outcomes? I will just tell you in a moment. But I also would like to point out that we were looking at the literature in English, Spanish, French, and all literature published between 2010 and 2020. Well, as I said, I will many times in this presentation focus or mention inclusive outcomes, transformative outcomes, and GESI mainstreaming. So what are those? In the context of this review, inclusive outcomes refer to those improving access and use of WASH for all users. These are, for example, female-friendly toilets, or any other outcomes that are actually allowing for equitable access to WASH facilities and similar. Transformative outcomes, on the other hand, are those that are challenging these harmful gender norms, and they're relating to women or other social groups that can gain greater control of their lives or resources. So this could be gaining financial autonomy through WASH entrepreneurship, or obtaining expertise in managing a water source. So we also know that WASH interventions are increasingly mainstreaming GESI components in their design. GESI is gender equality and social inclusion. And so these WASH interventions are doing this intentional mainstreaming of GESI in order to promote positive GESI outcomes, positive change in those outcomes. And they're there at any stage of WASH programming. I hope we will delve a little bit deeper in mainstreaming of GESI in WASH today. So just to show you quickly what was our review process, we started with a co-design. We identified and formulated questions together with stakeholders in WASH policy, practice, and research. We then published a protocol for this review, where we defined the search criteria, search strategy, inclusion criteria, defined the steps in the synthesis process, etc. Then we went on and searched for studies, include only relevant evidence, coded the metadata, emphasis on metadata, then provided a narrative synthesis of the findings, and come up with a systematic map report that is currently in review, peer review process. We have also held a one-stakeholder consultation during World Water Week in 2021 to show preliminary findings and to understand different stakeholder needs based on what we presented to them. And throughout all this process, we try to be as transparent, as repeatable, as objective as possible, to get as rigorous evidence-based as possible. Okay, so now to the fun part. First, I would like to show you the information flow of Prisma diagram of this of this review. Please don't get scared of this diagram, but I think the most important thing here is to understand that we have started at more than 76,000 records, and that we ended up including in our evidence base, after thorough filtering, screening, and metadata coding, we have ended up including 463 studies spread across 499 publications. These publications, these studies that were part of our evidence base were mostly quantitative research. About 50% was quantitative research, 1/4 was qualitative research, and another 1/4 mixed methods research. These studies were mostly evaluations of outcomes or impacts, and followed by process evaluations and other study types. Most of our evidence base actually comes from specific knowledge clusters. These are evidence from Bangladesh, Kenya, and India mostly, and a little bit more in other countries in East Africa. The rest of the low and middle income countries is sadly not as frequent or present in our evidence base. So in this map, you can see many knowledge gaps and a few knowledge clusters. The studies that we included in our review are mostly about water supply, sanitation, hand washing, and not so much about menstrual hygiene management or other types of hygiene. The interventions that were part of our evidence base were mostly about behavioral change, infrastructure provision, training, capacity development, but sadly not so much about tariffs, loans, and subsidies, or market-based approaches. And I think this mirrors actually the real-world implementation of different types of WASH interventions. Our evidence is mostly coming from rural settings and somewhat less from urban settings, and interventions that are applied at a household level or community level. But other types of interventions, other levels of application or other settings are not as frequent in our evidence base. So also, we have, as I already mentioned, mapped different inclusive and transformative outcomes, and most of outcomes included in our evidence base is inclusive outcomes. These are equitable access and use for safe water supply, sanitation, hand washing facilities. There are more than 80% of inclusive outcomes in our evidence base that are mapped. A little bit less, actually considerably less, but about 40% of the evidence base are about transformative outcomes. And these are these outcomes that help us challenge the harmful gender norms and advance progress towards inclusion. So outcomes such as provision of economic opportunities, empowerment and agency, different participation opportunities in WASH, education opportunities, physical safety and violence, etc. So these are the outcomes that we mapped and classed as transformative outcomes in our review. Also, one considerable finding to have in mind is the fact that we also looked at how studies were reporting their outcomes and who were these studies subject related to those outcomes at the data collection level. Sadly, almost 40% of these studies were not really specific about sex or social category reported in relation to the outcome reported. However, studies that did report, this other 60% of studies that did disaggregated data on social and sex categories were reporting mostly about women and men, somewhat about girls as well. Other social categories or age above 65 or below 11 was not as represented in the evidence base. And for example, outcomes that are reported in relation to sexual and gender minorities were none, and very little on disability, caste, religion, or ethnicity, and similar. So this now is showing the knowledge gap that exist. Okay, so to come back to actually GESI mainstreaming and interventions with GESI mainstreaming components, we wanted to understand a little bit more about this interventions. As I said, these kind of interventions are the ones that actively are trying to change GESI outcomes for the better. However, only 22% of the studies included in our evidence base, or about 104 studies in absolute terms, were about GESI mainstreaming. So these interventions were really under-researched in comparison to other types of interventions. GESI mainstreaming was mostly about capacity building. So capacity building of, for example, and training provision to women to build their own businesses, or provide participation and leadership opportunities, or provision of specific type of infrastructure or products related to WASH, or giving financial support. So these are kind of the types of mainstreaming activities. We were also interested on who was targeted by these kind of interventions with GESI mainstreaming. And we came to a similar conclusion as earlier. Usually the target of these interventions with GESI mainstreaming were women and girls, but people that are disabled or marginalized, even men or boys, were not actually a target of these kind of interventions, which shows also considerable knowledge gap. Okay, so we were also trying to understand what is the regional distribution of these kinds of studies with GESI mainstreaming, and we compared intervention with and without GESI component in relation to where the study was executed, where the study was located. So the yellow bit are interventions without GESI component on this graph, and the blue is intervention with GESI component. And you can see that the most of the evidence on these interventions are coming from Sub-Saharan Africa and South Asia. This actually mirrors the overall frequency of and distribution of studies in general in the evidence base. We also wanted to see whether inclusive or transformative outcomes are more or less reported in connection to GESI mainstreaming or not, and find out that, at least based on these graphs, that we can see that inclusive outcomes are more frequently reported in interventions without GESI mainstreaming, which perhaps makes sense. And GESI mainstreaming was more associated with reported transformative outcomes, of course. Okay, so to slow down a little bit here and to kind of summarize implications for research policy and practice of this research. Namely, addressing power relations and harmful gender norms, as well as equality, kind of it has been on global agenda, especially with sustainable development goals. However, we see a slow progress on this. Obviously, it is difficult. However, some further research could help addressing these issues. So, for example, diverse future research could incorporate in their understanding of GESI outcomes and WASH the evidence from diverse regions of the world and more diverse settings. As we could see from the findings, there are specific geographical clusters, but a lot of geographical gaps in our knowledge. There is also need to understand the effects of interventions with GESI mainstreaming in particular, to see really what works when it comes to GESI mainstreaming and what not. Perhaps this is something as a next step that comes from this evidence mapping. It would be also interesting to understand in future research whether GESI what are different GESI outcomes for different social and gender groups, other than women, other than girls. And also more research is needed on transformative outcomes in general. when it comes to WASH policy and practice, as I said, regardless of whether WASH intervention has a GESI mainstreaming component or not, it will result in positive or negative GESI outcomes. So why not capitalize on this, and why not design interventions that are specifically targeting and actively provoking positive GESI outcomes? I think we could all try, WASH policy in practice could try to do this. There is also need to target diverse gender and social groups, again, beyond women, beyond girls, to actually achieve a more transformational potential of WASH interventions. And also, although measuring GESI outcomes, especially transformative GESI outcome, is difficult and complicated, recently there are more and more tools, and Jess, our chair today, can tell you all about them. There are more and more tools for measuring, especially transformative GESI outcomes. So I think it's worth exploring this too when we are evaluating WASH interventions. Okay. With this, I would like to thank you for listening to my presentation, and I will stop here. You have some extra resources on this slide, and I will hand over back to Jess.
Wonderful, amazing, Diana. It's amazing to see. I was involved at various points in this process. It's incredible to see how much it's grown and reshaped. It's fantastic. We're now going to be hearing from two more presentations. Our next presentation is from Zinash. Zinash is normally based in Addis Ababa, where I'm actually calling in from today, but she is currently in Tanzania, I believe, if that is correct. And Zinash is the Regional Planning, Monitoring, Evaluation, and Reporting Advisor at WaterAid, and she's been with WaterAid since 2015 as a specialist for WaterAid East Africa. She has a background and a master's degree in economics, and so looks at the GESI WASH connections from an economic perspective. So I'm very excited to hand over the floor now to Zinash and to hear a little bit about how WaterAid might use these findings to improve programming in East Africa. So over to you, Zinash.
Thank you, Jessie. Thank you all. I would like to thank the organizers for giving me the chance to present something for this forum related with gender equality and social inclusion and WASH, especially the experience from WaterAid side. As I have said, as Jessie said, I'm working as a regional planning monitoring evaluation reporting specialist for East Africa, WaterAid, and based in Addis Ababa. Now in Dar es Salaam, Tanzania, for another workshop. Thank you so much. So the next slide, please. So my presentation actually focused on the practices we have within WaterAid. WaterAid is an international NGO, mainly focusing on water sanitation and hygiene. Established in 1981, and its vision is like everyone, everywhere by 2023 to reach, to give access for WASH services. Actually, like everyone, everywhere 2030 aims to contribute significantly to the achievement of the universal access to WASH, water sanitation and hygiene by 2030. So like, as you can see from the vision, everyone everywhere actually it articulates WaterAid ambition to tackle and challenge inequalities, which prevents the poorest and most marginalized people from realizing their right in accessing to water sanitation and hygiene. As you all know, like water and sanitation are human rights, and with hygiene are basic requirements for daily survival for the people to live healthy and dignifies their life. WaterAid actually serves like over 40 years, and we have reached around 28.8 million people with clean water, and 28.1 million people with decent toilets, and 26 million around with hygiene education. Next slide, please. So the rationale actually why we're talking about this issue is while significant progress has been made or achieved towards improving access to wash in countries where we are working or intervene, still vast inequalities are existed in terms of wash, quality wash services. And there is also huge disparities which continue to exist between the rich and the poorest communities. As most of research has consistently shown that even the burden of collecting water from sources located off premises, especially, still falls primarily on women and girls, which actually affects the inequality in terms of accessing the wash services. So WaterAid, to address the issue of gender equality and inclusion, we have developed a thematic framework called Equality, Inclusion, Rights Framework. So this framework actually sets out WaterAid's approach to have understanding about equality, inclusion, rights, and also to tackle the issue related with the GESI and eventually to contribute the elimination of those inequalities. So the previous slide. Yes, thank you. So this thematic framework, the Equality, Inclusion, Right framework, actually defines WaterAid position, scope, principle, and approach to support the organization to drive deeper changes internally, both internally and externally, for sustainable and transformative wash outcomes for all. So WaterAid's journey to address inequalities within and through wash are articulated in this framework. Next slide, please. So the principles actually underpin for this theme, the framework, we have three fundamental principles: that respect for and delivery of human rights for all, one, and the second one is to focus on strengthening systems to be sustainable and deliver wash justice for all, and working inside and outside WaterAid to address this inequality for sustainably, rather than like fixing the problem in the short term. Next slide, please. So WaterAid puts in the framework that the journey that we want to walk to address these inequalities, and like we want to stop the harmful practices, and we have to be inclusive, and slowly, yes, we have to empower, and then be transformative in addressing this gender equality and social inclusion. So like in the harmful part, as our accountability, we need to avoid causing harm by continually analyzing and learning and redirecting all our efforts. So we need to analyze the context that we are interviewing to understand the situation. So that one, yes, as an organization, we have to do that. And then as to be inclusive, like our minimum standard, we have the quality program standard. So in that standard, we already included at the minimum what we should have to be as an inclusive organization. And in the area of empowering, that's our approach. We strive to deepen outcomes, tackle an equal relationship in WASH, to foster meaningful partnership and drive transformational change, so that the long-term objective or goal is to be strived to transform power imbalances that stand in the way of this equality and committing to long-term and deep action. So these are the journey that we are planning to move to address the gender equality and social inclusion. Next slide, please. So like some of the examples of the transformative practice journey, for instance, in terms of the harmful that we want to stop or to avoid harm, is like, first, for instance, avoid talking on behalf of others or making assumptions about what groups require. So like, for instance, to address those issues, some of the areas that we are working, for instance, we we work in partnership with organizations working on right and representative groups. So for instance, while we're designing the wash facilities for instance, for people with disabilities, we usually engage organizations who are specifically working in people with disabilities so that they can comment or they can give us feedback on that, so that our service will release support people with disability. And even in the gender areas, we bring those organizations or work with those organizations in partnership so that we better address the issues related with gender equality and disability or inclusion. And the other one is involve or consult user groups, particularly at risk or marginalized users. So before constructing or planning activities or facilities, for instance, before we construct wash facilities, while we are selecting sites, for instance, for water point and for water system, we usually consult those groups so that we are able to accept their feedback and also even in selection of, we use their feedback in selection of the wash technologies and infrastructure. And the understanding that do not harm principles related to wash and development framework. So I think in this area, we are also working in people areas that's in terms of in their skills, attitudes, and diversity. So we try to change the attitude of people and even to build the capacity of the staff or the people within the organization to be more supportive in our goal. We work from a human rights lens, acknowledging the role of duty bearers and rights holders. So some of the areas that we are working in this area is working with the government at all levels, regional, national, and subnational level, and even influencing WASH strategic policies and standards so that to address this gender equality and social inclusion issues. Next slide, please. Thank you. We have also the quality program standards. So in our quality program standards, for instance, we set some of the standards as for instance, the risk critical minimum standards. These are the non-negotiable standards. And also we have also the minimum quality program standards based on the organization's capacity and intervention actually. And then we have also a fully quality program standard. So for instance, in our risk critical minimum standards, one of the standard is there are 6 identified risk critical criteria under the risk critical minimum standard. And one of that is we must ensure wash services are gender sensitive and inclusive and meets the needs of everyone at each stage of life. So facilities in public institutions must be designed for universal access. So addressing gender and inclusion is also built in the risk critical minimum standard in our quality program standard. So, and the risk critical minimum standard are the non-negotiable standard. Next slide. We have also the PMR core procedures. That is the planning, monitoring, evaluation, reporting. So this PMR core procedure, it describes the minimum requirements for our planning, monitoring, evaluation, and reporting. And it also helps to create a consistent approach across water aid on how we are planning, monitoring, evaluation, and reporting. So we also use this adaptive management approach for our programming. So in this PMR core procedure, actually, there are also wash user access and reach protocols. So this protocol actually defines the global mandatory indicators that are required for global aggregation and reporting. So wash user access and reach numbers are one of the key parts of a group of indicators in our overall strategic success measurements framework. So the wash access protocol also try to address some of the issues related with gender and inclusion. Next slide, please. Like, for instance, some of the existing practices, like at WaterAid, we have commitment on leadership, because commitment is one of the area for addressing this gender equality and social inclusion. So I think as a global organization, in some of the federations, there are some commitments, like in WaterAid Sweden, WaterAid Australia, and some of the regional team, and some country programs like Cambodia, Nigeria, Papua New Guinea. So in the leadership level, they are committed to address this issue. In addition to the commitment, actually, there are also gender audit reports conducted by some country programs, and also self-assessment on gender self-assessment. Some country programs also, they do the gender self-assessment, and even country programs, they're developing their business plan and even supporting governments at district level to develop the WASH business plan, and in that also to address those issues in the planning, and also in preparing gender policy positioning papers for better influencing the policymakers in addressing the gender equality and social inclusion issues. The gender disaggregated management demographic are available globally, and the management dashboard. This actually helps to monitor the turnover of staff in the gender distribution among the management and the leadership role. So we have a system called People Place. So from the People Place, the information actually, the dashboard actually developed for the decision makers to provide key information. So one of the information plugged in the dashboard is the information from the People Place. So that is one of the information feed into the dashboard for the decision makers. And country programs like Cambodia, Ethiopia, Tanzania also demonstrated system approach through alignment with government partners. So we established a relationship with WASH-related ministries to help scale gender considerations. So especially in East Africa region, where women is in ministerial leadership position are aligned with WASH and gender ambition. So like in Ethiopia, for instance, WaterAid Ethiopia work with the Ministry of Water for the establishment of the task force who's working on gender equality and social inclusion. Even in some country programs, they have similar kind of things to better clarify understanding among the government and the other civil society organizations working with WaterAid to have good understanding on the issue of gender equality and social inclusion. Next slide, please. And the other one is there is a strong organizational commitment to analyze gender and power, which is a primary driver in raising awareness and promoting practices. And also consideration for access to services for women and girls in gender self-assessment, gender and power analysis, and in baseline assessments, also including the Washington group questions, for instance, while we are conducting the baseline survey in a project, we try to include the Washington group questions to capture different kind of disabilities in the intervention areas, and to analyze and even to guide the intervention, the WASH intervention in that specific areas. There is also establishment of gender equality working group. This working group actually is used as a space for conversation and critical reflection and mobilization of resource, and also advancing the gender equality issues among internally as well as externally, because if the understanding among the internal staff is raised or clear, then they can use this one in their influencing and advocacy work, and even in the in the service delivery of their intervention. So like experience on applying or piloting gender responsive budgeting existed in some of WaterAid partner organizations. So this is also we consider that as a good opportunity to learn across the organization and also to scale up good or best practice related with gender responsive budgeting among other WaterAid country programs. Globally, the number of people reached with WASH services and system strengthening captured segregated by gender, age and location, community and school level, which is used for decision making at school level and also for generating funding or resources for WASH intervention. So we have a system called Project Center, for instance, for which supporting our planning, monitoring, evaluation core procedure. So in that, the system actually is used for managing our project and programs. So in the system, actually, all country programs, they capture the information, especially, for instance, for the WASH service delivery system strengthening. We capture the data based segregated as gender, age, and location, and that actually used for reflected in the dashboard and used by decision makers for any kind of decisions. The other one is awareness of the importance of gender disaggregated data is strong amongst the staff in country program team. So this is also one of the good opportunity we have. And next slide, please. Yes, we are trying to do something, but we are not like an organization that were best in addressing gender equality and social inclusion, but we have some practices which would be scale up for the next strategy period. Those, for instance, those practices and experience which I mentioned earlier are from the previous strategy periods. So WaterAid now, they globally, they develop a new strategy for the next 10 years, which starts from 2022 April to 2030 March. So the vision actually is to ending the water sanitation hygiene crisis together for everyone and everywhere. So in the new global strategy, I think the key aims are sub-national universal and sustainable WASH to address sustainable universal WASH in the intervention areas and to focus on WASH in health and hygiene, and also to focus on WASH in climate resilient and to work more and better financing for WASH. So this new strategy, this one is the aims for the global strategy. So country programs at present, they are developing their strategy for the next 5 years. So this is, I think, a good opportunity for country programs to focus or to work more on addressing gender equality and social inclusion. This next slide, please. The new strategy actually it has 3 approaches. The first one is to work as partnership in alliance. So because WaterAid alone can't reach its ambitious vision, but one of the approach set in the strategy is to work in partnership in alliance with organizations working on women's rights and even with disabilities. So this is one of the areas that we want to focus for the next strategy. And the other approach is to address gender equality across all our workers, whether it is service delivery, system strengthening, and advocacy. I think we need to advance the gender equality in the WASH for the long term. So we want to work on that area as well. And the other one is to focus more on evidence, learning, and innovation. So in this area, WaterAid, they have an ambition to invest in the resources that generate evidence to shape inclusive, affordable, and replicable solution for groups who are marginalized, with a focus on women's rights, and in the policy analysis and research, especially to focus more on action research. So in this strategy, I think one of the key focus or transformation is to work more on gender equality and social inclusion. Next slide, please. So thank you so much. This is what they want to share for you. So the next, actually, the new strategy has a very ambitious ambition in addressing gender equality and social inclusion. So we hope we will better address the issue of gender equality and social inclusion in the upcoming strategy across the WaterAid country programs and to achieve the global ambition in addressing those issues. Thank you so much.
Thank you so much, Sanash. It's wonderful to hear how WaterAid is thinking about these things. And I love to hear partnerships. One of my colleagues is doing her doctorate on WASH partnerships and partnerships with civil society organizations and particularly feminist organizations. So I think it's such a fascinating topic and something that we don't think about very often. Another thing I kept hearing, which was really important, is this idea that the transformation has to start within ourselves. In order to do transformative work, we really have to think transformatively from ourselves as well. So I think thank you so much for sharing those insights. I'd now like to hand the floor over to Sarah and to give a bit of reflections from the World Bank's perspective of what's happening from World Bank. So Sarah is a senior social development specialist with the World Bank, and she's leading the social inclusion agenda in the Water Global Practice team. She's worked for 25 years with the World Bank Group all over the world, the Middle East, North Africa, Latin America, Caribbean, and Africa, leading efforts to increase citizen engagement and social inclusion within World Bank lending and non-lending operations. And she works a lot within the approaches to inclusion in water, including things with the Nile Basin, Africa's region's infrastructure flagship provision programs, and other things, many, many things. Her full bio is online. And I'm really excited to hear, Sarah, from World Bank's perspective, how you think about gender equality, social inclusion, and WASH.
Thank you so much, Jess, and thank you to my esteemed fellow panelists. It was fascinating to hear how you were approaching this. I am probably going to go back and forth a little bit between some slides I have. I was actually initially just preparing to have more of a discussion and some key points I wanted to make. But I think, you know, this is such a huge area that part of it is how do we start, how do we, you know, what are we focusing on? So I don't want to cover obviously everything. I just want to take a couple of points that really build on sort of the research that Biljana has done and some of the things that Sanash has also referred to. So the World Bank Water Global Practice, with support of the Global Water Security and Sanitation Partnership, has sought to strengthen the social inclusion aspects of our interventions in water writ large and in WASH more specifically. We do this through generating knowledge, for example, on which types of interventions work, supporting the integration of lessons into our operations, building capacity, and accelerating cross-learning. Because I think one of the things is we all, at least I feel that you know, getting to greater inclusion is not always a linear process. So having the type of feedback from our own implementation is extremely important. It's you know, I think we have to be a bit humble about how difficult this sometimes can be, but that's what we're doing. And we also benefit extensively from, as I mentioned, the GWSP partnership, but also partnerships with others who are affiliated here, which I can go into. So at the World Bank, we have, I'm going to share just some slides as background. I'm not going to speak specifically to them. It says host disabled participant screen sharing. So I might not be able to share these, or maybe we need to share them again. I don't know if the host can allow me to. There we go.
You're now co-host. Yeah, exactly.
You should be able now.
Okay. Perfect. I think this is, let's see. Okay. Anyway, let me see if you can see can you see my presentation or the slide?
I'm seeing your screen at the moment, the main screen from your desktop.
Okay, so let me just see if I can move this over. That's because I have got to to
No worries. This is our daily battle, is it not?
okay. Let's see
We're
if I can
still
do
just
it.
seeing your desktop.
Okay, yeah, I've got two screens, so I'm just trying to move this over and we'll get it in just 1 second.
No problem. While Sarah's doing that, I'll just make a reminder. You have a Q&A box at the bottom of your screen. So please put, there are no questions currently. So if you don't put any questions, you're just going to hear all of mine. But I really would love to hear from you. So please put your questions into the Q&A box so that we can ask your questions either to Liana and to the SEI team, to Zinash and the WaterAid team, and then also to Sarah as she continues her presentation as well. So please make sure that you're making note of your questions. We're still seeing your desktop.
Okay,
Sarah.
I'm unplugging my external, it's my external
Okay.
monitor. Okay, can you see my slides now?
We see nothing yet, but maybe that's just staring at us.
Okay, let me go on and then I will come back to this in a minute. Let me try just one more time, see if I can share this.
Yes, we see your screen now. So we see the PowerPoint, PowerPoint space. So if you make it full screen, then we got it.
Yeah, sorry, I'm trying to get oh, there we go. Okay, so you can see it now.
Yeah, we got it.
Perfect. Okay, so essentially, we have a framework in the World Bank, and we have a requirement on gender diversity in our programs. And the framework that we use in terms of inclusion focuses essentially on water for whom, water by whom, in terms of who controls jobs and markets. Can you still see the presentation?
We just popped back into your main PowerPoint space. So if you don't want to do full screen again, that would be great. But
okay.
But this is just fine too. We're good.
Okay, I think I'm just going to go on with the discussion. But water for whom, water by whom, and who influences or who has voice in water. And we try to look at these three key aspects. Let's see if I can get it up here now. This is so frustrating. Primarily because we want to make sure that we're looking not only at equity and benefits from services, but also who controls water jobs and who has voice. So one of the things that we have seen over time is that what is extremely important is not just these aspects, but what drives deeper structural inequality are institutional processes, and whether those are aligned with greater inclusion, aligning incentives. So does the client have an incentive to actually provide water services to everyone, and also looking at norms, that norms have a tremendous impact on this. So let me just, I'm going to unplug this again so I can. And so what we have seen over time is that I'm going to pause. I'm going to pause the sharing. Sorry, this is a little bit distracting, so that I can just focus on the conversation. Give me just 1 second. Maybe can you go to the chat and questions while I work this out, because I'm having a little bit of trouble with the computer.
No problem, Sarah, not a problem. So we have a question from Pamela White. I believe this is towards the SEI team around the availability of the report from the review. And if there's going to be any kind of reporting done. So Liana, do you want to share a little bit about that?
Sure. So unfortunately, the report is still not available online. And I think if you have found a project webpage, this is great, because there we are going to upload the most final reports and papers whenever they're available. I really hope this will be there by the end of this year. So yeah, that's all what I can say for now. as we are not also in control of peer review process, obviously. So.
Yeah, perfect. Thank you. Sarah, are you ready to keep going, or shall we?
I am. I think what I'm going to do is I'm not sharing right now. So I'm going to go through my comments and then I will share the presentation since I can't seem to do both. But anyway, so here was the main thing I was trying to get to was that so over the past several years, we now have gender indicators and what's called gender outcomes in all of our water projects. At least we did in the last 2 fiscal years. And what that is, the way we approach it is that it's not just to define a gender target, it's also to define a specific outcome, a theory of change, the driving factors. What it does tend to do, however, is to favor, and I think this is one of the points that Biljana was making, some of the more things that you can quantify. So one of the challenges that we also have faced is how do we get to and how do we help our clients actually better capture things that are much more nuanced, like voice. So our clients tend to be water utilities, government ministries that are not always, it's not always their main focus of intervention. So that's, I think, a key point for discussion. I think the other thing that I wanted to talk about, and I'll just go over this and then I'll show the slides, is that so that's on gender. On broader inclusion, we have also increased in the last couple of years with the support of GWSP, the focus on disability inclusion, broader inclusion of Indigenous groups. Also, citizen engagement is one of the areas that we consider important to inclusion and voice and the processes for developing programs and policies. So that now we've increased that about over 80% of our water portfolio now at least has some action budgeting on broader inclusion, which I think is something that we're very hopeful about. Now that's at least at entry. But coming back to, what is one of the main ways that we tried to mainstream GESI into our operations? One of the questions is, where do you start? And so for us, one thing that's been very important is, particularly on gender, is to say we start by diversifying the institutions themselves, right? So if we are just focused on having some of our operations be more inclusive, that's great. But if you imagine that the institutions, for example, let's say a water utility has a majority of men, the question is what's going to happen after that project ends. And so for us, a key entry point, and where we put a lot of our effort, particularly for WASH on gender, is on diversifying water utilities. We have a program called Equal Aqua, which I will talk about in more detail when I go back to the slides. But that program essentially has helped with joint learning, peer-to-peer support, and benchmarking gender diversity in water institutions, and now influences. We've integrated indicators on that into about 37 of our water projects, representing about $5 billion in lending. And we've done that with a growing list of partners. In addition, in Equal Aqua, we also work with associations of women and youth, such as the Water Youth Network. We've had, so it's not only focused on, it's primarily gender diversity, but we've been trying to expand that little by little to other groups and other issues. We also, for example, have shared through Equal Aqua discussion among utilities on how to do better disability inclusion, on how to reduce gender-based violence, particularly in response to COVID. So I will show that in the slides in just a second. But I think for us, that's been important. And one of the things that's important is by benchmarking, we've also been able to start to see some real impact. And this question about how do we go back and measure impact is key. So for example, in Ethiopia, I think 23 utilities did a basic benchmarking on gender diversity in the water utility. And then, within about 2 years, we've already seen increases in terms of the percentage of female board members and in terms of women in more senior positions. The same thing in Malawi. we saw the process of having the utility go through a diagnostic actually helped to generate more support for that specific change. So I think, when we look at gender and social inclusion and mainstreaming, I think half of the challenge is how do you engage your clients on this? How do you get their ownership? How do you also look at the institutional processes and whether they're supportive or not, the incentives, whether they're supportive or not, and the norms. Is this shifting norms, for example, within that water institution? One of the examples I can give on sort of how that framework is feeding into a specific operation would be in Argentina, where we have an operation that, based on kind of the benchmarking data on gender diversity, is providing what's called a results indicator, results payment, for increasing the percentage of women in decision-making or senior positions in the largest water utility in Argentina, ISA. That program is, they've been part of Equal Aqua, and that program in a relatively short period of time is now seeing tangible change. And I think this is something that we find very promising. It also is fed into the percentage of World Bank projects that now in what are called IDA countries, I'm sure you know what that is, but that are now supporting medium and high skilled job for women. So about 80% of our projects, as of the end of our last fiscal year, we're actually supporting medium and higher skilled jobs for women. I think we have other examples outside of we talked about broader inclusion. We have a really interesting project in Indonesia called the PAMSIMAS project, which took disability inclusion and really mainstreamed it into participatory decision-making at scale. So what we do is we take projects like that and try to share them across the World Bank group, so that we can cross-fertilize experiences very quickly, and I think that's also important. So I think I will now go back to trying to share the presentation with you.
We
Go
can
ahead.
see your screen. So if you just go forward in your slides, if you click the next, we're seeing the presentation. We just see that first slide. I didn't want to stop you while you're on a roll. But if you just press the next button, I think we can get to your Equal Aqua.
So you can see my screen now.
We're just seeing the very first slide that you started with at the very beginning, the for whom, by whom, who influences. Yeah.
Okay.
So if you just go, I think you've got to just go a couple next, and then we'll see the Equal Aqua stuff, hopefully.
Okay, can you see this now?
Nope, maybe now it's frozen. Oh no.
It's my computer is actually not responding. I don't know if it's Zoom.
Okay,
So
it
let me
seems
just try.
maybe be frozen. That could be what's going on.
Okay, let me just try manually moving it. Okay, can you see another slide?
No, it seems like it's been frozen, unfortunately. I'm so sorry.
Okay, wait, let me try resume share. Can
Oh,
you see it
yeah,
now?
good. We'll just keep it like that. We can see your PowerPoint, but that's great. So
Okay.
no need to share, to do anything different. Just keep
All right,
it like
I'm not
that.
going to try to project it. I really apologize. It's acting very, very strange. So anyway, you can see the Equal Aqua slide. This is the platform that I was referring to, that we now have. I think it's the largest database on gender equality in water utilities. It's over, I think, over 160 utilities. And this is a partnership with many of, I think, some of the partners that are here, UTS and others. But I think, going back to this question of our framework and norms and how we shift norms. So one of the things that we tend to focus on is, why is the benchmarking important? And I think it's important because it allows us to compare across utilities. And in terms of how do you get a utility manager, to care about gender diversity, to care about providing services to women, and also to look at gender issues. And they tend to care what other utility managers think, right? They don't necessarily look at what a gender specialist thinks. So part of the kind of scaling up of the benchmarking, the peer-to-peer, the quantification, I think does help to support this shift of the norms, so to speak, at the industry level. And that was the example in Argentina, where it was, we were able to work with the client to say, look, we have some data that shows that gender equality actually leads you to better outcomes. And that's what helped them to say, okay, then let's put our resources here. Let me see if it's going to advance to the next slide. Okay, so there's 3 key components to Equal Aqua. It's an HR survey, a database, a scorecard, but also I think that another really key component is the sort of peer-to-peer quarterly meetings and the more qualitative work that is done not only by us, but also the partners in the platform, which allows us to quickly aggregate some of the good practices. We have essentially a fairly systematic framework of attraction, retention, recruitment, retention, and advancement, which I think having a fairly standard framework has also allowed us to see what different partners are doing, but by using the same framework, we're able to compare outcomes and results, which I think has been useful. Okay, I'm going to now also, I'm switching around a little bit, but switch to the other type of interventions that we often do with some of our WASH operations around menstrual health and hygiene. So we have been working to try to improve what we call the holistic approach to menstrual health and hygiene in our projects. Essentially, we started to evaluate our operations that were supporting activities on this and saw that really, you know, when we talk about the outcomes in terms of education and keeping girls in school, they were realized more often when you had obviously the, you know, menstrual products, but also the right facilities that are adapted, and also the information, education, and stigma reduction. And so we worked across the World Bank group to bring in, and also with other partners, to look at how do we actually begin to measure this more, first of all, approach it more effectively out of our silos in our operations, but then also to measure it more effectively. So, you know, one of the, and I go back to some of the sort of very practical challenges that when you're mainstreaming the clients face in measurement. And one of them is that, you know, if you're a water utility extending these services to a set of schools, you're not necessarily skilled at doing, you know, measurement of empowerment. So one of the things that we've tried to do is to increase the collaboration internally with education, and also on issues such as policies, such as taxation of menstrual products. What does the data actually show? What does evidence actually show? So that's an area where in our projects, we're now starting to partner more. We've seen not only that the percentage of projects addressing menstrual health and hygiene has increased, but more importantly, I think that the types of indicators we're starting to see are in partnership with education, more focused on things like, do girls report that they're actually staying in school longer, right? As opposed to just looking at the infrastructure. I'm almost done. So one last, I think, point that I want to make is the other type of work that we do. I talked about knowledge and looking at implementation. Is we also do a lot of work in terms of learning not only from ourselves but from others. What is working in practice? What can we learn from implementation? And this is just one sort of slide on a quick review that we had done to look at, okay, we know that, for example, through Equal Aqua, we have outlined in that a whole series of actions that can be taken to increase gender diversity, but what does the data actually show, and is it specific to water in terms of whether this actually works in practice? And I think that particularly this discussion with your group is one where we hope to learn more. I think there's a lot that we don't know, and that's what we saw. but it's so, I think, this practice of going back to implementation and being a bit humble about the change process, and when we mainstream it, really how fundamental it is and how we need to learn from it, is something that I really look forward to doing. We're trying to do at the World Bank, but really look forward to doing with you and with others. Thank you so much, and I apologize for all the technical difficulties.
No worries. Thank you so much, Sarah. It's wonderful to see. And I've done a little bit of work with the Equal Aqua stuff on the Institute for Sustainable Future side. And so it's wonderful to get to see it from this side as well. So thank you so much. And I love your thought about the humility of it. So I've just finished my doctorate in defining gender transformative wash and how we might measure it and what it might mean. And I have more questions than when I started with. And I think that's the entire point, is these things are inherently messy and they're hard for a reason. So I think it's a great reminder. We have about 5 minutes left in today's session. And so we have a few questions. We have one from Priscilla that I would love. This is for the SEI team, that maybe we can have you answer that. So it's looking at the 40% of intervention study did not count any gender disaggregated data. So when we make a recommendation that when interventions for interventions only women mean, do we want to take a more intersectional approach? So I could answer that from my rapid lit review, but I'd love to hear from the more robust one. What do you think about that, to the SEI team?
Thank you so much, Jess, and also thank you, Sarah and Zinesh, for your insightful presentations. Priscilla, so indeed 40% of the interventions did not actually show disaggregated, 40% of the studies did not show disaggregated data on the outcome level. So I was recommending in my last slide that actually more studies should be showing outcomes across different and more diverse, both gender and social equality categories, rather than only women and men. That was my point. So showing data across women and men, of course, is important as well, but even more information would be better, also to track the progress on SDG levels as well. And then maybe I should jump in here because we only have left. Bethany asked me a little bit more about whether we have searched studies that do not have GESI outcomes to be able to compare and to contextualize. Well, the short answer is no, because we have searched for studies that are particularly, our search string was composed of 3 levels or 2 levels, and one substring was about WASH interventions, and another substring was about all possible GESI outcomes. And that was a filter. And I believe that perhaps specific search for studies without GESI outcome might not be needed, in particular because there are so many studies out there on non-GESI outcomes as well. So health, in particular, diarrhea and stunting. So I think that was our initial assumption.
Wonderful. Yeah, that's really great. I have a question that came out of my doctoral research that if I'm okay to ask to the group, and this is probably going to be our last question. So if you have any other questions that you haven't been able to put in, please put them in the Q&A and we will do our best to type the responses while I'm asking this question. So one of the challenges we have in what is is defining a transformative outcome. And I don't know if anyone is wanting to tackle that, but maybe we could have the SEI team. How did you go about defining what is transformative versus what is not?
Well, I have provided, it is, thanks Jess for this. This is a very delicate question, actually. And I have provided kind of a rough division between inclusive and transformative outcomes. You could see on my slide what we considered as inclusive and transformative outcomes. And in our case, inclusive outcomes was anything to do with actually equal access to specific WASH wash facilities or attitudes about wash or knowledge about wash, and transformative outcomes were related to issues about participation, empowerment, etc. Actually, if you go to our protocol, you will see a theory of change that we have developed in order to be able to divide our outcomes on inclusive and transformative, and you could see what was our thinking behind that.
Amazing, wonderful. We'll have to have a follow-up conversation on this. Yeah, so just to highlight, there are many amazing organizations working on this. We have the Emory crew who also did a lit review kind of in a similar space. I've done a lit review in a similar space with the ISF crew. So there's a lot of interest and work being done on this topic. So I can say for those who are interested, watch this space because there's a lot of good minds thinking about these things. And the pie is very big, which is a wonderful problem to have. We have a big problem ahead of us to solve, but I think with a lot of minds like we have on this call and those who have participated in this review, we're going to make some progress on it. So thank you so much to our three presenters today. Thank you so much to CETL, or am I saying it correctly? Perhaps not, for hosting our session today, and for UKAID for sponsoring this as well. And if you have any further questions, please put those into either the Q&A, or I believe there's a way to follow up through the exit survey that you will get as you leave today's session. So is there anything else, housekeeping from the Directorate or from SEI?
Thank you, Jess. Thank you so much. Thank you, everyone, for attending. And
absolutely, big thanks.
Thank you.
Thanks so much.
Thank you.
Bye.
Thank you. Bye. Thank you.